Gynecology focuses on the treatment and prevention of disease affecting the female reproductive system and can result in surgery for diagnostic, therapeutic, or cosmetic purposes. Fertility medicine combines GYN and endocrinology to achieve and maintain pregnancy, and obstetrics relates to the process of pregnancy and birth. Psychological considerations for this obstetrical and gynecological patient must be addressed. The patients have concern for reproductive ability, self-image, identity as a woman, and fear of cancer and death. Many questions involved with assessment can be embarrassing to the patient because they deal with private issues. These specialties require the caregiver to understand how the patient interprets her surgery and what it means to her. Respect for the patient's modesty is extremely important in all cases. Please review the objectives for this chapter. The structures that make up the external female genitalia are called the vulva, and it includes the mons pubis, which is a raised mound of tissue that protects the symphysis pubis. The labia majora are two external folds of adipose tissue that envelop the perineal area. The labia minora lies directly beneath the labia majora. The clitoris is a highly vascular organ that contains sensitive erectile tissue. The vestibule, all structures located within the labia minora. The vestibular glands are called the Skene's glands and the Bartholin glands. The hymen is a thin vascular fold of tissue that attaches around the entrance of the vagina. It separates the vagina from the vestibule. The perineum is located between the posterior vaginal wall and the anus. The internal organs of the female reproductive system include the uterus and the cervix, the fallopian tubes and ovaries, the uterine ligaments, and the vagina. The largest organ in the female reproductive system is the uterus. It is a pear-shaped organ approximately 2 inches long and 2 inches deep. It is composed of thick muscular tissue. The superior portion of the organ is called the fundus. The middle portion is the body, and the lower portion is the cervix. The most common position of the uterus is tilted forward towards the front of the pelvis. The wall of the uterus is composed of 3 layers. The endometrial layer is the innermost layer and lines the uterus. It changes under hormonal influences in pregnancy. It is continuous with the lining of the fallopian tubes and the vagina. The myometrium is the middle layer and is a thick muscular layer. The muscle is capable of contraction, which occurs during childbirth and during menses or period. The perimetrium is the outer serous layer of the uterus and is reflection or folding back of the abdominal peritoneum that is reflected over the bladder. This forms a pouch called the cul-de-sac. During surgery of the uterus, this portion of peritoneum may be excised and then resutured and is often referred to as the bladder flap. The cervix is donut-shaped and located at the inferior neck of the uterus, which extends into the vaginal vault. The cervical os is the opening that may be surgically dilated, or it can be dilated on its own under hormonal influences. The os has 2 anatomical sections, the external os and the internal os. These 2 openings communicate by a short canal. The fallopian tube lies on each side of the uterus near the fundus and communicates directly with the uterus. Each fallopian tube has 4 sections: the interstitial, isthmus, ampulla, and infundibulum, listed from uterus to ovary. The fimbria are small projections that extend from the end of the tube. The fimbria are not connected to the ovary. The fallopian tubes, ovaries, and their ligaments are collectively called the adnexa. The ovary is the female gonad or sex organ, and they come in pairs. They are responsible for female reproduction and responsible for the production of female hormones. They lie on each side of the uterus in the upper portion of the pelvic cavity. The ovaries are suspended by the mesoovarium, which is peritoneal tissue attached to the uterus by ovarian ligaments. The fibrous surface of the ovary is uneven, containing follicles which hold ova in different stages of maturity. The ligaments that surround the uterus are suspended from the pelvic cavity are called the broad ligaments. Above the broad ligaments, near the fallopian tubes, lie the round ligaments. These help support the uterus anteriorly. The carpal ligaments lie below the broad ligaments and provide the primary support of the uterus. The uterosacral ligaments curve along the bottom of the uterus to suspend the cervix and uterine body to the sacrum. The vagina is a muscular passageway that shares a thick fibrous wall with the rectum on the posterior side and the bladder on the anterior side. It extends from the vestibule, which is the opening outside of the body, to the cervix. The bones that make up the pelvic girdle are the sacrum, ilium, ischium, and the pubic bone. The internal iliac branches of the common iliac artery supply blood to the female pelvis, with supplemental blood supply coming from the ovarian, superior rectal, and the medial sacral arteries, which are branches of the aorta. The autonomic nervous system supply the nerves, and the lymphatics follow the path of the vessels to the iliac and preaortic nodes, or empty into the inguinal glands. Many women go to the doctor for treatment of abnormal uterine bleeding. This will often be seen as a preoperative diagnosis for surgery. The conditions that fall under the diagnosis are metorrhagia, amenorrhea, dysmenorrhea, menometorrhagia, and menorrhagia. Several diagnostic tests are done preoperatively. Some of the routine malignant screening. A simple blood test, a CA-125, is performed to screen for ovarian cancer. An ultrasound can be performed through the pelvis or transvaginally to look for abnormalities. A hysterosalpinography is done by injecting radiological contrast into the uterus and fallopian tubes, then using fluoroscopy. An MRI is used to determine exact location and size of tumors. A pap smear is a screen for cervical cancer and is routine in the doctor's office to check for chlamydia, herpes, trichomonas, vaginitis, beta hemolytic strep during pregnancy. And the colposcopy is a microscopic examination of the cervix. Most GYN procedures will be done with the patient in the supine position or the lithotomy position with either high or low stirrups. The supine position is also known as dorsal recumbent. The patient is positioned with the head and spine in alignment. The arms should be placed on arm boards at less than 90-degree angle to prevent brachial plexus injury, or one or both arms can be tucked by the patient's side. A safety strap is clasped A safety strap is placed midway on the thighs. Sometimes a pillow is placed under the knees to take pressure off of the lower back. In the lithotomy position, the thighs are abducted and both knees and hips are flexed. A low lithotomy position is achieved with the legs resting on low padded leg holders. High lithotomy is achieved with the use of candy cane stirrups. Yellowfin stirrups are used to adjust from high to low lithotomy. It is very important to raise and lower the legs simultaneously. It is also important to protect the perineal nerve when candy cane stirrups are used by not placing the strap directly on the Achilles tendon and not letting the knees touch the stirrup. It is important that the buttocks not hang over too far over the end of the break in the table to protect the sacral nerves. The abdominal prep extends from the nipple to the mid-thigh on both sides of the body to the operating room table. A vaginal prep is performed with the patient in the lithotomy position. The pelvis, labia, perineum, and thighs are prepped first. The vagina is prepped separately with sponge forceps into the vaginal vault. Betadine paint only should be used in the vagina. For laparoscopic procedures, the abdomen and vagina are both prepped.